Hello everyone, I'm Dr. Raymond Tang, and with me is Dr. Louis Lau from the Chinese University of Hong Kong, Department of Medicine and Therapeutics.
Today we are going to share with you our latest article published in GIE, named as the effectiveness of prophylactic clipping in preventing postpolypectomy bleeding in oral anticoagulant users, a propensity-score analysis.
So Louis, can you tell our audience why we want to perform this study?
Thank you, Raymond. Because colonoscopy and polypectomy is a very commonly performed procedures in our daily clinical practice, and postpolypectomy bleeding is one of the most common complications that we will encounter, and prophylactic clipping is mostly effective in large and also proximal colonic polyps, according to our latest evidence. However, there is a subgroup of high-risk patients on antithrombotics. Whether prophylactic clipping is effective in this particular group of patients remain uncertain, and therefore we want to perform this dedicated study to investigate this. In our latest study, we performed a propensity-score weighted retrospective cohort study. We retrieved patients in our center from 2012 to 2020 who received an oral anticoagulant and underwent colonoscopic polypectomy. Data on their baseline demographics, medications, and also endoscopic factors were collected. We developed propensity score models between the prophylactic clipping and no clipping groups. The primary endpoint was defined as any clinically significant delay post-polypectomy bleeding, which is a composite endpoint of hemoglobin drop of greater than 2 grams, any blood transfusion requirement, or repeat colonoscopy for hemostasis within 30 days from the index procedure. So in total, we recruited 547 patients with 1,485 polyps in our study. The baseline characteristics of both groups were comparable and also balanced with propensity score. The remaining variables were included in the doubly robust model. And finally, our results showed that prophylactic clipping was not associated with reduction in the 30-day delayed post-polypectomy bleeding risk. The only significant risk factor for the post-polypectomy bleeding was hot resection method. In our subgroup analysis to assess the effect of prophylactic clipping in different settings, we observed that prophylactic clipping was associated with a lower bleeding risk in direct oral anticoagulant users, but a higher risk in warfarin users. It was also associated with a lower bleeding risk in patients with delayed resumption of their oral anticoagulants, and also those with left-sided polyps.
So Louis, we have two important take-home messages for our audience. The first one is prophylactic clipping was not found to be associated with a reduced overall risk of post-polypectomy bleeding in patients on oral anticoagulants, except a potential benefit in a subgroup of patients on DOAC.
Secondly, in these high-risk patients, we found that hot resection method was associated with a much higher risk of post-polypectomy bleeding, and therefore we should maximize the use of cold snare polypectomy in these anticoagulated patients.
We would like to thank GIE for giving us this opportunity to share our research on this video abstract.